My name is Amos Kibara. I am a counselor by profession. In this session, I want to address the process we take our clients through after we have admitted them at the Prudent Camp Counseling at the Rehabilitation Center. When somebody is admitted, if this person probably has just been brought to the center from home, and probably this person has had an issue to do with having been in drug use or alcohol use for a long time, this person will suffer the issue of withdrawal symptoms. And one of the most important thing after this person has gone through the process of admission, the next thing is to this person have a session with a psychiatrist who do the assessment on how is this person faring when it comes to issues of mental health. How can this person be assisted in now going through the withdrawal system, medically assisted. And this is a process that comes first, that we stabilize the body so that this person doesn't suffer such issues like hallucinations, shakes and tremors, issues of delusions, issues of hearing voices and seeing things and feeling like they are things that are creeping on their skin. When that is managed, the next thing we want to focus on is the issue of making sure that any other underlying issues, could it be depression, could it be issues to do with other mental condition, could it be other disorders, the psychiatrist is able to pick these things during the initial assessment session, and is able to advise us as the people in the rehabilitation center who are interacting with the client daily on how do we go about managing the client, and especially when it comes to the biological aspect. After that, we are able to introduce the client onto the issues to do with why are we here, why have we been separated, or why have we been brought into a rehabilitation center. And this is where we set the goals. This is where we set the objectives of where do we want to go and why. This is where we do what we call the treatment plan. And the client knows that this is now where I will need to go. This is where my life ought to be. And because these people, they are learned people, they are educated people, they are coming from somewhere. Some of them will have just maybe come from their businesses, of their places of work. So they are not a people without a sense of direction. So they are able to know that this is how my addiction has hurt me. This is how my addiction has kind of made me not to be doing very well. And they are able to go to help us, even assist them in the planning of how do we go about the process of the rehabilitation. After that, we are able to go into what we call the 12 steps program, where we are able to take them systematically through step 1, 2, 3, and each and every step has a specific area of building or development within the recovery plan. And we usually say that step 1 to step 7 is about this client or this individual understanding himself and resolving his own issue, inner battles, issues of inventory. Then step 8 and 9 is about other people around this individual. They could be family, they could be friends, all others. And then step 10, 11, 12 is about the maintenance of that life that they have now been able to achieve. Then we do what we call, in the process, we'll have engaged the family, because the family is a part of the support system, is a part of the people who got harmed in the process of this person being in active addiction. And we bring them on board so they are able to heal alongside their loved one. And if anything, at the end of the day, we will be taking this back, this individual back to the family, so the family knows how do we go about interacting with this person. This is where we emphasize issues of making amends, issue of forgiveness, issue of letting the things in the past go, and we pick up the new life that we want to live. Then we have what we call the relapse prevention. This is where we equip the individual with the skills on how to go about living in a world out there that has not changed, but this person has changed. So there'll be people out there, there'll be places out there, there'll be things out there, there'll be feelings and emotions within this individual that he need to know how to cope without thinking that if I would go back and maybe start on my drug of choice, I'll be doing okay. So the issue of relapse prevention becomes very important. After this person has now completed the program in the rehab, we release him or discharge him out with objectives of where is he going to start, or where is she going to start, what comes next, what happened, who does what. After a 2 weeks period, we would be in touch and request this individual to come back to the center, and we are able to now have a session and evaluate. And every other 2 weeks, we encourage our client to come back and check with us. They come and they reconnect with others that they were with, and we are able to see a great advancement, a great recovery path taking shape in so many people that we have discharged. And I think this is basically what goes on in a rehab center. The issue of group therapy, the issue of personal therapy, the issue of family therapy, the issue of life skills, issues of relapse prevention. This is what we do every day in the rehab when somebody is with us for the duration of 3 months. My name is Counselor Amos Kibara. I am the Director, Prudent Camp Counseling and Rehabilitation Center based in Thika. If you have a loved one whom we can be able to assist, or you have somebody that you would want maybe to find out more from us, how we can go about helping him or her, kindly get in touch with us. Our telephone number is 0700 345 403, or you can visit us on our website www.prudentcamprehab.org. We look forward to hear from you. God bless you. Thank you, and just realize that there is hope for people who could be struggling with issues of alcohol and drug and substance abuse. God bless you. Thank you.